done one of these. Most of what we have today are updates that if you have been subscribed to our listserv, you have probably heard. And then we have a more in-depth presentation on insights. Let's go ahead to the next slide. So I'll do some basic certification program updates and reminders of some upcoming deadlines. We will then go and walk through some updates to the electronic prescribing testing tool. And then, of course, we will turn things over to our insights team, who will go through the insights condition and maintenance certification with some information about the measures and changes and enforcement discretion there. Next slide. So I, of course, am Rob Anthony. I'm the director of the Certification and Testing Program, and we administer ONC's Health IT Certification Program. We will also have Aaron Little from our team, who will be going over the e-prescribing, and then we have two folks from ASTP, ONC's Technical Strategy and Analysis Division, by Shalay Patel, the Deputy Director, and Megan Gabriel, who both work on the Insights team and will be covering today's Insights topics. Next slide. All right, so a handful of things to go through on this. You have probably seen most of this again in listserv, so nothing that is earth-shattering here, but just want to make sure to reiterate for anybody who may have missed. You may have seen this about enforcement discretion on the US CDI v3 data elements. There was an executive order that went out on the 20th of January, and then the Office of Personnel Management did issue a memorandum of guidance to all federal agencies. Pursuant to that, ASTP and the ONC Health IT program are exercising enforcement discretion for conformance and also for testing related to US CDI v3 data elements related to gender. You can see this at our website at healthit.gov. There is an enforcement discretion statement that goes through all of this if you want to take a deeper dive into the rationale behind it. But essentially, we will not be reviewing and testing a number of the sex and gender identity data elements pursuant to OPM guidance. Next slide. Do want to remind everyone, upcoming deadline, even though we are 6-7 months away from this, that US CDI v3 is required by the end of the year. So any health IT module that is continuing certification under the program in those criteria that reference US CDI, any health IT module that would be getting newly certified to any of the criteria referencing US CDI will have to be compliant with US CDI version 3. That again is on our website. You can take a look at a full description of the data classes and data elements that are part of US CDI version 3. Again, that is by December 31st, 2025, of end of this year. Next slide. Similarly, by the end of the year, there is a CCDA update requirement. If you have a module with criteria that references the R2 CCDA implementation guide for clinical notes, the release is being updated to from release 2 to release 4.1, and there are some additional capabilities that are in there. Recommend that people take a look at the IG and companion guide for CCDA to get a good idea of everything that entails, but that needs to be implemented and capabilities provided to customers by the end of this year. I think many folks are already compliant with this, but just want to make sure that everybody knows that that compliance is required by the end of the year, and importantly, providing the capabilities to customers by the end of the year. Next slide. There are also a number of minimum standard code sets that are required to be updated by the end of the year. We will distribute these slides to folks afterwards so you can look at this. I will not go through all of these, but many of these are things that I think everybody is already conformant with, but we do have updates for some areas of SNOMED that we require, for some of the basic HL7 standard code sets related to vaccines, for some of the lung code sets for laboratory, any variety of these. So if you have any of these certification criteria in any modules that are impacted, those need to be updated to support those minimum standard code sets by the end of the year. Many folks are on a code set that is more advanced than these minimum code set updates, and that is perfectly fine. These are the minimum code sets. So just want to clarify that for a number of folks. This is sort of the floor, not the ceiling. But this is what everybody needs to be at a minimum compliant with by the end of this year. Next slide. There are also some functionality updates that need to be implemented by the end of the year. So if you have E1, which we affectionately call VDT, most people think of this as patient portal. If you have a module that provides that functionality, the update for functionality by the end of the year is that patients and their authorized representatives have to be able to use some sort of internet-based method to request a restriction for any data elements within US CDI. So basically, they can restrict specific data elements that they do not want to be passed along or made visible to other providers or other folks with whom the record may be shared. This is required again by the end of the year and affects anybody who has a certification to the E1 view, download, and transmit patient portal, most people call it. Next slide. And then we have updates to G10. This is the standardized FHIR API. Again, by the end of the year, we are updating to V3. Talked about that previously. That means updating the FHIR US core that API in G10 supports. That is the FHIR US core version 6.1.0, which supports V3. So you must be able to, at a minimum, support that. And it also means updating the HL7 Smart Application Launch Framework to the 2.0 version. Again, this is for G10 FHIR API by the end of the year. Next slide. Did want to say this to everybody. We did update some things with the site tooling. There had been some issues that I think a handful of folks had encountered. I'm not going to go through all of these, but there were a number of different issues that essentially caused either an incomplete or an error message and made it impossible to actually complete the test. We have corrected virtually all of those. We have deployed fixes for these. We do recommend that before you go and use site tooling, make sure that you review and verify that you have downloaded all of the current certificates that are available on the website and have installed those. Otherwise, you may run into the same fixes again, or some of the same issues again that we have fixed. We do know that there is an outstanding issue that should not affect testing for folks about the direct certificate discovery tool. We are working on resolving that. It requires some extensive coding fixes on the back end, but it should not affect anybody from a developer perspective as far as testing on this. But apologies for the issues that folks may have encountered on this one. We do believe that we have deployed all of those fixes as of last week and should be up and operational now and be verified. Next slide. And then I am going to pass on to Erin Little to give some updates about electronic prescribing.
Thanks, Rob. Good afternoon. My name is Erin, and I'm going to give you a brief update. So we've been working hard to update the electronic prescribing tool with the newest script standard version required for certification. And we are happy to announce that developers will be able to begin beta testing these changes for the script standard version 2023.011. and that will be available starting next week on Monday. This beta testing will be available through December 31st of this year. So you'll have 6 good months to get in and click around and play around. Our stage environment is linked here, and we're going to take a look at it in a second. You'll be able to go here, create a login. So it looks and functions identically to the production environment that you're used to. What you'll do is create a registration. Your login for the production environment will not work here. So you have to create a separate registration and login for the stage environment, but everything still functions the same way. In the upper right-hand corner, you'll see the tool scope. So in the stage environment, you'll be able to have access to both versions of the tool, whereas you cannot see the most updated version in the production environment yet. But you'll be able to click around in the stage environment and do some beta testing there for all of the updates to the data types and such. And so we have if you go back to the slideshow, we have a dedicated Google group for you to provide your feedback to. We're going to send this information out as well.
My apologies. We are.
No worries.
Oh.
I think it's the middle in there. The middle.
Oh, there we go. Sorry.
Yeah. So we have a dedicated Google group where you can submit your feedback after you have a chance to take a look. If you see anything that needs any updating or anything that you have suggestions for, you can go into the Google group and post there, or you can directly email your feedback to the Google group and it'll post in the Google group. And so we'll send this information out to all developers. And thank you for your continued partnership. And we can go to the next slide.
Great. Thanks, Erin. This is Vishali Patel, and I'm here to speak about the insights condition and maintenance and certification. And I'll be also, Megan will also be joining me on this. So the agenda for this discussion will be covering just an overview of the insights condition, just providing a bit of a refresher on that. And then we'll be going into updates, recent updates to the insights condition. Megan will be speaking about the enforcement discretion and guidance, the flexibility related to measurement specifications, and guidance related to the percentage of customers included in data, which is one of the requirements that I'll be touching on today. There are going to be guidance related to that coming soon, but we're actively kind of working on that. So we won't be providing an update on that today, but please look out for that in the coming weeks. So, next slide, please. Okay, great. So just a refresher, I know most of you are probably familiar with the insights condition, but it has been a while since it was finalized as part of HTI 1, and so we thought it would be good to just touch on this briefly. The 21st Century Cures Act called for the development of an EHR reporting program, and so this is something that's required by statute, and it really specified that, it would be included or implemented as part of the condition and maintenance of certification for certified health IT developers. And the goal was to provide transparent reporting to measure the performance of certified health IT. And so we at ASTP have sought to turn that requirement into something that really provides transparency around addressing information gaps related to the health IT marketplace, providing insights on the use of specified certified health IT functionalities, as well as providing information about end users' experiences with certified health IT. And we kind of renamed the EHR reporting program to the insights condition to avoid confusion with other EHR reporting programs in the past, and as well as to highlight the goals of this program, which are really to shed light and provide insights. Next slide, please. So who is required to submit responses for the insights condition? Actually, all developers are in fact required to submit a response, and it's either a response that relates to the measure itself, if the developer is deemed eligible, and I'll go through that in a minute, or they attest that they don't meet those eligibility requirements. So a response, either a measure response or an attestation, is required for all developers. But in terms of who, with regards to the measure responses themselves, those need to be at the product level. They should include data sources and methodology, as well as the percentage of customers represented. So that's included within the measure response. Now, if a developer is not eligible for reporting, then they would attest that they do not have at least 50 hospital sites or 500 clinician users. So the reasons why they are not eligible, that they're not large enough, that they don't have the certified health IT technology for a given measure, or that they don't have users that are actually using that certified functionality. And developers must submit responses, either the data or the attestation, on an annual basis, beginning the first response itself is due July 1st. However, the first data collection would start on January 1st of 2026. So there's data collection for a year, and then the response would be submitted on July 1st of 2027 for the first round of insight. Next slide, please. And in terms of, to expand on like the timeline a bit here, the reporting period, as I mentioned, the data collection period is 1 year. So if we look at this timeline here, the calendar year 2026 is when a developer would begin data collection, and throughout that entire year. And then a developer has 6 months to collate and assemble the data. So from January through the end of June. And then the reporting, either the reporting of the measure response or the attestation that they are not eligible for reporting, would occur during the month of July. And then simultaneously, in thinking about the subsequent, year, the developer would collect data beginning in January of 2027 for collecting data for the year 1 and the year 2 measures. So, and then the cycle kind of repeats itself, where you have 6 months of assembling the data, and then the reporting would occur during the month of July. Next slide, please. So how will the measures be reported? I think, as I mentioned earlier, responses are aggregated and reported at the product level across versions in the format that's specified by the measure. And there's some nuances here. So as we kind of clarified in the final rule for HTI 1, certified health IT developers with integrated certified health IT products will only have to report 1 response for those metrics where that applies. And then certified health IT developers using relied upon software to meet certification requirements are responsible still to report on the insights condition measure, and will have to work with their relied upon software vendor if necessary to report on those metrics. Certified health IT developers will also submit responses and documentation for insights using a web-based form and method. And we will be providing templates that enable submitting the data in a structured electronic format. Megan will be talking a little bit more about this more specifically later in this presentation. Next slide, please. With regards to documentation, certified health IT developers shall make the required and optional documentation available via a publicly accessible hyperlink that allows any person to directly access the information without any preconditions or additional steps. And this is really consistent with the way, other aspects of reporting on documentation for the certification program, such as with real-world testing. So we wanted to make it consistent with that. The responses themselves will be made publicly available through a website that we are developing, and the insights condition responses may also be used to meet the real-world testing plans and results requirements. Next slide, please. So these are the measures and the related criteria that were finalized in HTI-1. We had four different areas that relate to interoperability that the measures focused on: individual access, clinical care exchange, standards of adoption and conformance, public health information exchange. And we had measures and related metrics for each one of these measures that were finalized in HTI-1. Megan is going to be describing the enforcement discretion and some of the flexibilities that we'll be providing that are updates to what we finalized in HTI-1. But we did want to just share that, broadly, that this was finalized in HTI-1, and then what actually will be reported on come July of 2027, Megan is going to be describing those updates. Megan, why don't you take it away with the next slide, please?
Okay, thank you. So as Vishali mentioned, there were a number of measures that were finalized in HTI-1 that were part of the Insights Condition reporting requirements. However, in line with Executive Order 14192, ASTP is using enforcement discretion to ease the regulatory burden on developers. So for now, only one measure is required, and that's the use of FHIR in apps through certified health IT. So as of, just like Vishali mentioned, as of just July 1, 2027, this is the measure that you'll report on. So ASTP will not take enforcement action on the other measures mentioned. So developers do not need to collect data or report on those. This really lets developers focus efforts on transparency and real-world API use while avoiding unnecessary sunk costs. And this measure is also important for ASTP's priorities related to FHIR. Next slide, please. So this is a table we put together to summarize the current enforcement discretion for the insights condition. As you can see from the red X's, most measures are not currently required. So those include those measures related to individual access and electronic health information, clinical care information exchange, public health information exchange, and standards adoption measures like the FHIR bulk data metric. So the only measure that's required is highlighted in blue, and that's, again, the use of FHIR in apps through certified health IT, which we find in G10. So that's the only reporting requirement being enforced right now, and it's the same one we discussed on the previous slide. Next slide, please. So we are also providing developers with the flexibility to use either version 2 or version 4 of the specifications. And I'll detail those differences in the following slides. But please note, throughout this deck and in the resources slide that Vaishali will speak to, we've linked to numerous key resources and documentation that we think you'll find really helpful. The link on this page specifically goes to a fact sheet that compares version 2 and version 4 of the measure specs. Next slide, please. So this measure, again, is the only required measure now under enforcement discretion and focuses on how FHIR is actually being used in real-world app integrations with certified health IT. So the purpose of this measure is to track how often and in what ways FHIR resources are returned from certified health IT deployments to apps. So there are 3 key metrics for year 1. This would be just like Vaishali mentioned, this would be the calendar year data collection. So from January 1st, 2026 to December 31st, 2026, and then reported in July 2027. So these metrics include the number of certified health IT deployments with at least 1 FHIR resource returned, broken down by user type, the number of requests that returned at least 1 FHIR resource, categorized by resource type, and then the number of certified deployments active during the period, again, broken out by user type. Then in year 2, so that would be reported in July 2028, we add 1 more metric, and that would be the FHIR resource returns broken down by US Core Implementation Guide version. Again, just like Vaishali mentioned, all reporting will be aggregated at the product level. And as she mentioned, ASTP will provide you with structured templates to support and streamline submissions. We'll keep you updated on those and send them along as they're finalized. And all data and attestations will be submitted through a secured portal. And as mentioned, data submitted under Insights may also be reused in real-world testing plans and documentation. Next slide, please. So again, developers are welcome to use either version 2 or version 4 of the specification for this measure. And in short, in version 4, we just expanded the definition of user type to also capture the counting of endpoints that serve both patient-facing and non-patient-facing users. So there are 2 additional data points in version 4 which report on this additional category of user type, but the reporting of these is optional. So aside from this definitional update, the core metrics and reporting timeline, they all remain the same. And so the flexibility of using either version 2 or version 4 allows developers that may have already completed their metrics based upon version 2 to proceed with their submission. Next slide, please. All right, so now Vaishali and I will go through your next steps, talk through some key questions, and then provide all the resources that were detailed in this presentation. Next slide, please. Yep. So here are your next steps. So first, check your eligibility by answering these kind of 3 key questions. And if you answer yes to all 3 of them, then you are required to submit data. Otherwise, you would attest that you don't meet the reporting qualifications. So do you have at least 50 hospital sites or 500 clinician users across your certified health IT products? Does your product have a certified API? And does it have users? So if you do meet those reporting requirements, the next step for you would be to choose your specification version. So either version 2 or version 4 of that FHIR measure. And again, optional metrics from version 4 are not required. And then you'd prepare for 2026. So again, starting January 1st, 2026, you must begin to collect the data for the FHIR use measure. Obviously understand your documentation requirements and stay tuned for those submission templates that we mentioned. And just a reminder, you must submit a response. So either your data or an attestation beginning July 1st, 2027. And Vaishali, if you want to take it over to walk through some frequently asked questions.
Great. Yeah.
Yeah.
So some frequently asked questions that we've received that we wanted to address here live include the question, do I still need to submit something if no measures apply to me? As we noted earlier in the presentation, all developers are required to submit a response. And if no measures apply to you as a developer, you would still need to submit an attestation that you do not meet the qualifications for reporting. The second question that's come up is, does the enforcement discretion mean I still need to collect data but not report it? And the answer is no. For measures other than the use of fire in apps through Certified Health IT, you do not need to collect or report data while the enforcement discretion is in effect. And the third question that has come up includes, can I use version 4 of the measure specifications? And the answer is yes. You may use either version 2, which was finalized in HDI 1, or version 4 for the use of fire in apps measure. And finally, another of the last question that has kind of frequently come up is, when do I need to start collecting data? And for the required reporting as of July 1st, 2027, Certified Health IT developers need to begin collecting applicable data starting January 1st, 2026. Next slide, please. All right, so just one last point of reference here is that we wanted to share the resources that were available for the insights condition. These include, the main sort of page where the insights condition resources are, the CCG, the clarification related to the flexibility of using either version 2 versus version 4 of the fire use measure. So that's in that clarification fact sheet. And then the enforcement discretion information is also separately, there's a separate web link on that if you want more information. And then last slide. So for any questions that we haven't covered or anything that further comes up, please submit those questions to the inquiry portal. That's the best way for us to answer the questions. We can keep track of them, and ultimately it's publicly available. So appreciate everyone tuning in today for these updates, and I will hand it back over to Kim.
Thank you, Vaishali. I think I'm going to hand it over to Rob in case there are any questions that came up during the presentation.
I don't have specific things to come up that were Q&As. I think they were there for folks to see. We also will circulate those. I will say, if your question wasn't answered here, encourage everybody to go to our Health IT inquiry portal at healthit.gov and submit questions through there. I have seen a couple of things regarding some of the test tools and asking about some specific scenarios or specific code. If you would please submit those through JIRA, we can go ahead and make sure that one of the tool subject matter experts can do a deeper dive with you. So thank you, everybody. Appreciate your time, and hope that this has been useful for folks. Have a good rest of the afternoon.
Thank you all for attending today. ASTP will post the slides and recording on the healthit.gov website in the near future. And if you have any further questions, please use the Health IT feedback form to submit your questions, and a member of the ONC Health IT Certification Program team will respond to you. Thank you.